children came from 5 facilities, 4 being public facilities run by the government, and 1 being a faith-based institution. So we came up with this intervention plan that would involve the caregivers and also the children living with HIV. So we actually did home visits for all the 35 children and did assessments of their living environment just to understand the challenges that they were facing. We also had one-on-one discussions with the children living with HIV, as well as their caregivers. And then we were able to bring them all together and have a joint discussion. And then after that discussion, we came up with a plan on how to, improve adherence and subsequently hopefully achieve suppression. Again, we put them in sort of a support group where we had a sharing platform where caregivers could talk to each other and, give support based on the agreed upon interventions. For where we were having a challenge with the caregiver not being able to remember when to give the drugs, we were using reminders, and this included alarms and pill boxes. So we were able to work with them to be able to improve adherence as we aimed for viral suppression. In care for these children, it's very important to do education of the caregiver so that they can understand the treatment that the children are taking, and also to involve the children and the caregivers in the treatment protocols, and to have those discussions together and have agreed upon interventions, because then such a therapeutic alliance facilitates free discussions that positively impact on the treatment outcomes for these children. Again, for us as a city, we have embraced quality improvement and continuous quality improvement as a protocol for evaluating clinical progress. Using this model, you're able to keep track of your indicators and the outcomes that you desire for health within that specific facility. So whenever there's a drop in performance, then you're able to pick it up. You are able to assess, and evaluate progress of the facility and even of the clients based on the outcomes that you require of the treatment that you're giving them. And then you're able to formulate interventions that you can actually track, adapt, and then enhance based on your analysis after you've been able to carry out the implementation plan.